So starting with upper trapezius attachment, we're going to take the entire spine of scapula. One hand will have to stabilize the shoulder, otherwise there will be too much movement. And the other hand will apply those small, precise circular motions in towards the bone. So for spinal scapula, my vector of force is roughly superior to inferior, circling all the way around, following the spine of the scapula until we get to the acromion. Continuing the same vector, superior to inferior, staying on the acromion with those small circular motions. And then from the acromion I have the clavicle, and on the clavicle the same superior to inferior vector. So I always want to press in towards the bone this way. Now as far as the circles go, I can emphasize any of the components, either moving the tendon of the trapezius away from the bone, so trying to think about peeling the tissue off the bone, trapezius going this way, which works really great for the clavicle. Or I could emphasize compressing the tendon in towards the periosteum. So those are the two components of the circular frictions. Again, it does not change the vector of force, which it will always be towards the bone. And that is the end of the spinal scapula. Now, since I'm at the spinal scapula, I could go straight to the superior angle of the scapula to address levator. Now for this location, my vector of force is superior to inferior, but I'll also have to angle it slightly anterior just to catch more of that flat surface of the angle. Otherwise it can be quite sharp for the client. So note how my finger is slightly oblique in this area. So again, the vector of force superior to inferior with a slight anterior angle. Okay, another way to do this, you could reinforce your fingers. The scapula won't move quite as much in this area, so you could have quite a good body mechanics using your body weight, leaning into the client to get that nice pressure for your circular frictions. Now the other end of the levator scapula was up at C1 to C4. Remember, the transverse processes are now pointing up towards the ceiling, and I will need to be on the posterior aspect where the tubercles are. Therefore, my vector of force will be posterior to anterior. So I'll have to sink into the tissue a little bit so that my fingers can press posterior to anterior into those posterior tubercles.